My name is Dr. Khalid Anwar. I'm a consultant in physical medicine and rehabilitation at Amana Medical and Rehabilitation Hospital in Abu Dhabi. So physical medicine and rehabilitation is a medical specialty which is concerned with the diagnosis, evaluation and management of patients with physical and cognitive impairments and long-term disabilities. So physical medicine rehabilitation consultants are trained in the management and rehabilitation of patients with neurological impairment, musculoskeletal problems, impairments of other organ systems like cardiac, pulmonary and cancer, and management of long-term disabilities. So rehabilitation is a process aimed at enabling patients to reach their maximum potential in terms of their physical, cognitive, psychological and social functioning. So in other words, it gives them the tools for them to be enable them to be as independent as possible with the best quality of life. As far as the post-acute inpatient rehabilitation is concerned, it is a specialized short stay in inpatient rehabilitation program. And this is aimed at patients with strokes, traumatic brain injury, other neurological disorders, major surgeries and major medical events soon after the events. So enable them to recover and regain as much functional independence and quality of life as possible. So this program enables the rehabilitation team, which is a specialized team consisting of rehabilitation physicians, physiotherapists, occupational therapists, specialist nurses, speech and language therapists, social workers, dietitians and pharmacists, etc., to work with the patients to achieve their goals as best as possible. So the aim of this program is for the patients to be able to go back to their home and to work in as functional manner as possible. Post-acute rehabilitation is a very specialized program, and I'm very proud to say that Amana Rehabilitation Hospital is the first facility in UAE to get accreditation for their post-acute inpatient rehabilitation program. So the rehabilitation process starts for the patients even before they are admitted to Amana Healthcare. The patients are assessed by the admission team on a very fixed admission criteria to make sure that the program is suitable for the rehabilitation needs of the patient. So once the patient is admitted to the facility, and bear in mind that this program is a short stay inpatient rehabilitation program, the rehabilitation program is planned in the very beginning, right from the admission to discharge. So what it means is that as soon as the patient is admitted, the rehabilitation team sits down with the patient and the relatives, the family. The personal rehabilitation program is chalked out for the patient, and the discharge process also starts from the day one. So the team goes about the rehabilitation program with regular goal setting processes, assessments, reassessments. There is a process of regular discussions with the family and the patient itself, and so the team actually works with the patient to achieve the goals set out by the patients in consultation with the rehabilitation team. So in summary, this is a very specialized program which is patient-centered, goal-oriented and time-limited. So in Amana Hospital, we see a broad spectrum of patients requiring rehabilitation. So we see patients after stroke, after traumatic brain injury, spinal cord injuries, neurological disorders, musculoskeletal injuries, fractures. But if you look at the statistics, the main bulk of the patients probably are that we see are after stroke or traumatic brain injury. And it is not surprising to see that spectrum, because there's a high risk and incidence of stroke, especially in young patients in this part of the world, and there is a high incidence of road traffic accident resulting in brain injuries. I'm very excited to be part of this conference, and I'm looking forward to meeting with my fellow professionals, not only from this country but from other countries as well. Now, this conference is one of the largest conferences in physical medicine rehabilitation in this area, and gives an opportunity for the professionals in the rehabilitation field to come together, to exchange ideas, to learn from each other's experiences, and to network with each other. This conference also gives an opportunity for us to raise the awareness of rehabilitation in the context of the healthcare in this country. And as people know that rehabilitation is relatively a young speciality, and there is a need to make not only the lay people but also the medical community aware of the importance and value of rehabilitation. Also, I think this conference, what it does is hopefully help us raise the standards of rehabilitation in the local healthcare system.